Welcome to the Eos Rejuvenation post-op rhinoplasty video. In this video, I'm going to go over the different things that are in your post-operative bag and how to use them so that you can have an easy recovery. When you leave the surgical center, you'll have a little piece of gauze taped underneath your nose, and we call that a mustache dressing. You only need to change that as needed as it gets soiled. What you'll find is that after 1, maybe 2 days, you'll no longer need it because the oozing and the drainage will be kept at a minimum. In this bag, there's both tape and gauze so that it can be refreshed as you need it. Next up is learning how to clean your nose. We include some hydrogen peroxide in your post-op bag to help with that. You're going to use Q-tips, and it may take a lot of Q-tips, especially at the beginning, sometimes 30 or 40, to get the incision and the nostrils as clean as possible. You want to be very gentle and patient when cleaning the incision as well as the nostrils, as it can be a little bit sensitive. Once the incisions are clean and the nostrils are clean, you can apply some antibiotic ointment to the inside of the nostrils as well as to the base of the nose. We also include some chapstick in your post-operative bag to help keep your lips nice and moist after surgery. Next, we'll talk about the saline. This is used to clean the inside of the nose, especially when you feel like you want to blow your nose. You won't be able to blow your nose after the procedure just because of all the delicate work that we did, so we have this more gentle method of cleaning the inside of your nose. After drawing up some saline inside the syringe, you'll use that to push the saline inside your nose. You'll do a gentle sniff to help clean out the tubes, and you may notice some salt water come in the back of your throat, which is completely normal. It's best to do this over a sink in case some of the salt water comes out and you want to spit it out. Now please feel free to use the saline at least 8 to 10 times a day. In fact, the more you use it, the better off you'll be. The cleaner you can keep those tubes, the less congested you'll feel and the less pressure that you'll have. Next, we'll talk about the bruising and how to take care of that. We include both Arnica gel, Arnica tablets, as well as some Arnica pads that go underneath the eyes. When you leave the surgical center, you'll have pads underneath your eyes, and these need to be changed every 6 hours. The nurse will show you how to cut the patches and place them underneath the eyes. Once the patches are finished, you'll switch over to the Arnica gel, which will be applied 3 times a day underneath the eyes. Continue taking the Arnica tablets as prescribed before your surgery. Once we're done with surgery, you'll be transferred to our recovery room where you'll be waking up. After about an hour or so, you'll likely be able to go home, and our nurse will take you down to the car where your caretaker will be waiting for you. At that moment, our nurse will go over some instructions, very likely some of the things that we've gone over already in this video. When you get home, it's really important to have your humidifier running 24/7. It's best to have it in the bedroom where you'll be spending most of your time. I also encourage patients not to lay in bed for the entire week. As soon as you feel up to it, make sure you get up and walk around the house at least, and if you want, you can even go outside for some fresh air. The one thing to avoid is very strenuous exercise. I don't want you running, jogging, weightlifting, playing frisbee, or playing soccer. It's okay to take a shower 24 hours after the procedure, but the important thing to remember is don't let the water run on your face. That could loosen the cast and affect your results. On the day of your cast removal, you can take a shower and get the whole cast wet. Getting the cast wet will make it easier for it to come off when you get to the office. As for the medications, please refer to the directions on each of the medications that you have. We've already discussed the antibiotic ointment, which will be placed inside the nostrils and on the incision after cleaning it with hydrogen peroxide. Please do this for the first week after surgery. There's also an antibiotic which will be taken at least once, maybe twice a day, depending on your prescription. It's very important that you take this, and that will usually last about 5 days. Finally, we include some prescription strength pain medication that can be taken as needed for pain. Now, this pain medication can be very strong, so if you're not in that much pain, you can take some plain Tylenol instead. Please avoid things like Advil or Aleve or anything else that's not Tylenol or acetaminophen. Those other medications can thin the blood and cause bad nosebleeds. Next, we'll talk about icing. In your post-op bag, we give you some gloves, and these gloves are used to fill with ice cubes, and you'll place them in the fingers individually. Afterwards, you'll tie the top and lay the ice on your face like this with 2 fingers on either side of the nose. This is to help reduce bruising and swelling after surgery. Finally, the expected post-operative course. Please remember that it can take at least 6 to 12 months to fully heal from a primary rhinoplasty, and if this is a revision, it could take anywhere from 12 to 24 months. Please take a look at that sheet that goes over the emotions after surgery because it's fairly accurate. There's a lot of excitement that first week or 2 right after surgery, but at 3 to 4 weeks, when you look at yourself in the mirror, you may still look a little swollen and feel a little down. That's completely normal and it'll totally pass. After that 3 to 4 week mark, you'll start to feel more confident and more happy with the surgery. I'll be seeing you at 6 weeks, 3 months, 6 months, and yearly after that.